Huh? Yeah. Doctor, ready to do the camera here? Chairman? Thank you, Doctor.
We are about to start the inaugural ceremony shortly.
Expressing, and again this compassion is so critical. As I was saying, there is this societal change that is happening in the field of oncology against the backdrop of overcome it, and hence the issue of survivorship. It is the quality of survivorship which is equally, if not more important to the person, anyone in the society. It is very fundamental, it's very moral, it's very ethical for that person to behave like that. However, it is true that although the cures are increasing, we do pay them a price. And one of them is radiation-induced collateral damage. And hence, the need for particle beam therapy, which we heard, what a fantastic day we have had today to learn about the latest nuances and the potential of this technology to usher in really a new dawn, especially in this part of the world. I am, on behalf of whole Apollo fraternity, so indebted to the Particle Therapy Cooperative Group PT Tomorrow and the literally who's and who faculty that we have been interacting today and also tomorrow, who have spent so much time, and for their generosity that they came all the way to teach us, and we learn from them, and we have been witness to the wonderful day that we have had. Thank you again so much, PT Corp.
Thank you, Dr. Jalali. To mark the represents the positive and good spirits, leading us from darkness to light. The lamp depicts the 5 elements of nature: wind, space, fire, water, and the earth. Welcome to this evening's program. Everything begins with an idea, and Aristotle once said that if the idea is not absurd, it's just not worth pursuing. So at Apollo we hear many absurd ideas, audacious ideas, but I think we've learned to put logic behind them, to put teams behind them, to make them something that is not only conceived but make it a reality. And today I thank the entire team for being there to do that for us. When Chairman first came back from the US in 1960, it was actually the year that Apollo, the spaceship, went to the moon. And here on Earth he was visualizing a hospital that would be the best in class, equal to international hospitals. So at that time he didn't think of just one hospital, he called it Apollo Hospitals because he thought of care not only for the 1 billion Indians, but for all those around India who could have wanted international treatment but couldn't afford it, and he would at Apollo, which would provide international quality care at 1/10 of the cost. So when he said proton, I got really frightened, I must say, because I said proton, the only thing that I could connect it with was CERN, which, have any of you heard of CERN? It was a particle collider. And I said, here we're going to do something, you know, at CERN they were looking for the God particle. At Apollo, with proton, we're looking for a cure for cancer. I said, will we ever be able to do it? And at what cost will this happen? Today, it's really tremendously rewarding to see doctors and the team who have brought it together, and people from around the world who've come to help us do that. So 25 years ago, I think Chairman started this focus on oncology. Not many of you know that he lost his mother to cancer, and maybe the germ of the idea started then. But he took it beyond just an idea. Today we have 180 clinicians. We do about 1,800 bone marrow transplants, 3,500 onco robotic surgeries, 200,000 onco surgeries, 200,000 radiation, and 600,000 LINAC procedures happen at Apollo. So this is not small. I mean, it's clearly grown, and it did for a certain reason. It's because at Apollo we believe at putting the patient front and center of everything that we do. That we take it one step beyond. It's not just the infrastructure, the equipment, but it's also about great clinicians and how they operate. So we do have a tumor board, we have a breast cancer registry, and immunotherapy. This year, to that we added, machine learning, artificial intelligence. We have IBM Watson that we work with, but we also work with a third opinion. And I must say personally, nothing can replace the wisdom of our wise doctors. So Apollo together has been boldly rewriting the narratives around cancer care, and I believe that we have replaced fear with hope, and fear with strength, and fear with resolve, that we can make everyone a cancer survivor, that cancer is conquerable. I think the difference that has evolved over the past few years is that we were looking at survivorship, which Dr. Jalali spoke to me about yesterday. It's not just about curing the cancer, but looking at the quality of life post the cure. So sometimes, when they radiate on the left breast, women have heart issues. Children suffer from growth defects because of radiation. So proton, I believe, is a solution to this. It improves the quality of life post the cancer treatment. It does not cause secondary cancers. And from this, the idea of survivorship was clearly taken focus. I do believe that, while we are inaugurating this in Chennai, we're taking this to 3 billion people around the world. At Apollo, we've treated people from 120 countries. And this is not just an India story, but it is an international story. It's a story of how we learn to collaborate with great minds from around the world to find a cure for cancer, which I think is almost universal. Just yesterday I had the editor of Bloomberg magazine visit me, and of course he was doing a very financial article on Apollo and its strategy. So he says, he asked me what defines your strategy, and I said we look at the demand-supply gap and we try to fill in that demand with something that makes, gives excellent clinic care as the denominator, and as a numerator it gives us great returns. Then he goes to Chairman, and Chairman says, you know, our strategy is decided by the 80,000 people who work for us, and I was really impressed with that. But today I come here and I see and I know now that our strategy is really decided upon by the 3 billion people who come to visit Apollo with the hope that they will find not only a cure, but beyond that, that they will find quality of life. Today, I think we've made a good beginning, and I thank everyone for being part of this journey. Thank you. Thank you very much.
Namaste. Namaste.
Namaste to you, sir.
It is my very great pleasure to be here, and I am reminded here, just by meeting the people, of the wealth of Indian innovations. Some things that have been attributed to developments in other parts of the world were actually invented in India. One can go back to the plow and to the microwave communications before Marconi. Or one can find more household items like shampoo. Looking into the more esoteric topics, it turns out that the first use of the symbol for zero was in an Indian manuscript 200 years before BCE. And who doesn't know what the Chandrasekhar limit is, or at least the physicists here? The innovation extends to medicine with cataract surgery, alternative medicines, multiple transplants at the Apollo Hospital. And there have been Nobel Prize winners from India. And of course, in the US, Deepak Chopra is very popular. So, it's with this knowledge of the culture and innovation that it's reassuring that a tool like proton therapy can be in good hands. That's not to say that it's easy and that it doesn't require study to do it in the correct way, but we have just lit the flame to push away the ignorance, and we will all be able to share in its benefits. As I've mentioned earlier today, PTCOG is an organization which helps to promote the safe use of particle therapy throughout the world using the scientific method and sharing of knowledge and education. But our organization has been slowly growing over the decades, and the first of these meetings was in the 1980s. We've only recently grown to have enough resources to help do more. We have a membership of over 2,500 professionals, and our annual meetings now draw over 1,000 attendees. We host over 50 companies in our exhibitions, and our original mission to identify the specifications for a safe hospital-based delivery of particle therapy have grown to include events like this. This is the first such event that we have hosted in PTCOG with our hosts here in India, in Chennai. It was just a natural evolution of our work in PTCOG and a natural evolution of the work of the Apollo Hospital in Chennai. This organization, the organization of this meeting, required the unresting work of Dr. Hakan Nystrom from our PTCOG group, and of course John Chandy and Dr. Jalila. I did not count how many times we talked and emailed, and I asked John Chandy, what time is it in India? And maybe it was 4 a.m., maybe it was 3 a.m., but apparently he doesn't sleep. And it's clear that such a motivation had to come from the visionary example of Chairman Dr. Reddy, who gave the motivation to develop so much, and the most recent one now, of course, being the Apollo Proton Cancer Center. I'm just so impressed with the tremendous hospitality we've enjoyed during our visit, and I'm honored to be together with my PTCOG colleagues. Some would say they are the dream team of particle therapy education. But I started this meeting, with the greeting Namaste. And since I have been in India, I've recently learned more about its meaning. Namaste, not me, but you. And it is not about the PTCOG dream team. It's about the people of India who are beginning their use of particle therapy. It's about the patients who will be treated on these systems. It's about the safe use of tools that can help and for PT-COG to do what is possible to you to help with these goals and to encourage you to learn and do what is necessary to succeed in this field. I look forward to the rest of the meeting tomorrow and finding time to talk with more people and learn about your goals and plans. I urge you to do what you can. I urge you to ask and learn better and apply the technology and the modality in the best safe ways. So on behalf of myself and my colleagues of PT-COG, I do want to thank you, and I say in the best way that I can, Dhanyavad.
Ladies and gentlemen, well, the program says that I am delivering a special address. But then, while here today, I feel so elated. I feel so much blessed to be in this group today that I am overwhelmed, and I'm not capable of delivering any special address. When I look at your program that has all those special addresses today and tomorrow again. So what I will do is partly what the speaker is going to do later, that is Thanksgiving. So I will thank. I will thank to start with Dr. John Chandy. He has been briefing me on this program right from the beginning of the year. He has been sounding me that this is going to happen. And it was sometime in July this year that he said we are almost fixed a date. It will be in November. I think he may be remembering that before he finished his sentence, I said, yes, I will be there. I will be there for a variety of reasons. One of them is that as my stint today as a chairman of Atomic Energy Regulatory Board, I have found that there are many agencies who are using ionizing radiation for benefit of society. Huge benefit to the society. And when I look at the people who work for societal benefit, it is not only with ionizing radiations. There are towers of excellence in this country. This institution, Apollo, is one example amongst them, who work for the society, for the larger good of the society. And therefore, I should also get a picture along with them. That is the objective of being here. There are organizations which do similar function. You are one prominent amongst them. But then I have attended a similar workshop, not this big scale, with you some couple of years ago. And that was the first time I could meet person to person with Dr. Pratap Chandra Reddy. And that meeting has left me a memorable feeling. I feel godliness manifest with him. Being with him, you feel that you are in the lap of a god. And it is for that player that I am here. And I must thank again Dr. Chandy profusely for giving me this opportunity. Friends, while government is playing its role in health services very effectively, but institutions like Apollo is a role model who have transformed India in variety of ways, and health is one of them. Health is a prominent one amongst them. It is the healer in Dr. Reddy who initiated this process. I express my sincere gratitude to Apollo and others whose compassion has been converted to ideas, and ideas have been converted to action before time as far as this country is concerned. And proton therapy is an example of those bold actions which have initiated from the compassion you have for the people at large. We, the citizens of India, are blessed to have world-class facilities, and now this proton therapy. Proton therapy is one part of the spectrum you are handling. It is starting from telemedicine for the rural population. There's a large number of colors, visible, invisible, in this spectrum. Well, coming to proton therapy, Atomic Energy Regulatory Board was also very new to this technology when we had to handle this for the purpose of licensing, which is mandatory. So we had to learn along with you, and you gave us ample opportunities. For Atomic Energy Regulatory Board, the question paper is out. What we will look at? We will look at the siting requirements, the layout, the type of equipment you use, and the people, the qualified people, and ultimately the quality assurance program. I must confess that while dealing with you on this project, what we have found is that you do not need a regulator. Yes, you need a question paper, what are the requirements from a regulatory point of view for safety, but that is all you need. You are a self-regulated institution. You go beyond the demands of regulatory activities, and learning from institutions like you and others, we are going to grossly simplify our regulatory procedures now, and they are almost on the anvil now. Many of the steps will now be left to you. You will be self-regulating, and we will be only seeing the final result of the pudding when you start commissioning. These changes in regulatory process are due to your performance, very good performance in launching your projects. You don't need a regulator, that is what I again say. In this regulatory process, we do emphasize on training of the manpower which you are going to use, professionals. And what we found is that in a very proactive manner, you have trained the people, trained them extensively at the best places in the world. And not that you have keeping this training to yourself. Today you are providing it to the whole country. And we know the facilities are following in rest of the country. And this is not the first course of its kind, though even though the title says it is the first program. But I know whenever you held a workshop, it was associated with a training program, a education program. Sometime you have done some of that in the evening. While we go into education module, it also helps to find out which are the areas which are grey to us, where we have the ignorance. Education also brings about where we are ignorant today. And that is again a very important component of your work. I know that Dr. Jalali is planning to do a lot of research, because as we go along, as we look at the patients, we will find that there are areas which need research. And that is also part of the proton therapy, and we are very glad that research is also being considered along with this, and that will, following that, there may be another sessions like this in the coming years. Well, I think I must close, but again I have to repeat that I have been personally motivated by visionary and missionary leaders like you, Dr. Pratap Reddy. And the tradition runs into family. We have seen how well the proton therapy was explained to you. And just before this session, I met another member of the family, Harshad Reddy. And I found that he is the next generation enthusiast. So this tradition runs into the family, and we are grateful to the family as a citizen. Well, I must end this, but before I end, I want to convey a small message from my wife. It so happened that last Saturday, my son was undergoing a minor surgery at Apollo Hospital in New Bombay, that is Belapur, and we were in the waiting hall there. And my wife was trying to read what was going on the TV monitor there. And after going through the TV monitor for quite some time. She said, what are they doing? They are telling you how not to get into lifestyle diseases, what you should do, what you should eat, what should be your total lifestyle that you don't get into these diseases. They are working against their business, she said. I said, this is Apollo. And I explained to her my interactions. Well, I must tell you that when we were leaving the hospital, at the entry gate there is a portrait of Dr. Reddy with a message conveyed there. She stood there silently, read through the message. So, sir, this is the silent appreciation you get from the people who visit your institutions. And there are a large number of them. My wife is not alone. So, thank you very much. Jai Hind.
Thank you very much.
To witness this important milestone in medicine, not only in India, but in all our continent, especially Africa, where we collaborate very much with India in healthcare. And I must say that I'm looking forward to learning. I'm looking forward to understanding how Proton Care will revolutionize our healthcare. In Uganda, we have worked informally with Apollo, but I want to tell you, Chairman, that today, this afternoon, we're meeting with the Vice President of Apollo Hospital, and we agreed that this relationship must move forward in healthcare, in training, in working closely with you. Want to thank the medical fraternity for the excellent work that you are doing. We know that this is not the hands for one person or a few, but it is a team. And we look forward to working with you, and we thank you. Thank you so much for allowing us to be part of you on this important day. This is a very, very important day in our history, not only in this country, but also in Africa, because we know that when you improve healthcare here, we are definitely the beneficiaries. Thank you very much.
Program Director, for giving me the opportunity to address this very august assembly of men and women who are dedicating their lives to the well-being of those less fortunate. Excellency Ramnath Kovind, President of the Republic of India, Honorable Narendra Damodar Modi, Prime Minister, Honorable Ministers here present, Dr. Pratap Reddy, Chairman of the Apollo Hospitals Group, distinguished guests, ladies and gentlemen. At the very outset, allow me to express our sincere gratitude to our gracious hosts, the Government of the Republic of India and Apollo Hospitals Group, for their warm welcome and legendary hospitality extended to me and my delegation since our arrival in this beautiful country. I bring greetings for His Majesty King Letsie III, the entire Lesotho nation, and indeed the Indian community living in Lesotho, particularly the more than 1,500 Indian expatriates and professionals working in our country. The Indian professionals working in Lesotho are highly valued by Basotho as they immensely contribute to our socio-economic development. I can assure you that they have received the same warm welcome from us that you have given to me today. In the same vein, I wish heartily I thank the Apollo Proton Cancer Center and the Particle Therapy Cooperative Group for kindly inviting me to participate as a guest of honor in this very important event, making history in Southeast Asia. I have no doubt that our deliberations for the next 2 days will be a resounding success. Today's event takes place at a critical juncture in human history. That's not cancerous, no, not at all. Today's event takes place at a critical juncture in human history when mankind is confronted with multifaceted challenges ranging from poverty, disease, conflicts, inequality, climate change, and many other very serious challenges. At the international level, we have agreed to address these challenges by putting in place a new agenda for sustainable development, commonly known as Agenda 2030. While in Africa, we have adopted the African Union Agenda 2063, both of which envision a prosperous, secure, and free world in which every person's needs shall be met. Yet there is not enough acknowledgement that our aspirations to achieve sustainable development for all will elude us if we did not have a healthy global society. It is in this context that we commend the organizers of this event for their hard work and dedication towards the finding of solutions to some of the most complex health challenges facing the world today. This conference that has brought together so many eminent scientists and health professionals to discuss the latest state-of-the-art technology that provides a weapon against the dreaded disease of cancer speaks to the commitment by Apollo to remain as a front runner in bringing affordable and health care to the best health care to the world. Cancer is a menace that knows no borders or age. It does not respect the color of your skin or the amount of wealth you may have amassed. It decimates young and old people alike. In most developing countries, including Lesotho, together with other non-communicable diseases, have overwhelmed our health systems and left countless of people with no hope. According to the World Health Organization, cancer is the leading cause of death globally, with about 1 in 6 deaths occurring as a result of this disease. Though we do not have a cancer registry in Lesotho, it is estimated that there are 500 new cancer cases annually, and that 4% of mortality in our country is due to cancer diseases. Data from our health facilities and laboratories indicate increasing incidence of cancer diseases, with most common cancers as prostate, breast, cervical, Kaposi's, and Hodgkin's lymphoma. Although the increasing prevalence of cancer in 2011, the Kingdom of Lesotho, with the support of the International Atomic Energy Agency, AGAIA, conducted a baseline assessment of cancer diseases, whose main aim was to determine the extent of the problem as well as measures to be undertaken. It was this assessment that indicated a need for the country to establish a national radiography center. To date, the preliminary design is available and human resources development for the center is on track. Radiation oncologists and medical physics are already undergoing training. It is hoped that the facility will be completed in the year 2020-2021. Today, all primary health care facilities in Lesotho provide health education and promotion, cervical cancer screening and breast cancer examination for women, with emphasis on self-examination. At secondary district hospitals, there is cryotherapy for cervical cancer biopsy services. Major surgery is done at tertiary hospital, while histopathology is done at the National Reference Laboratory. However, there are no treatment services of either chemotherapy or radiography in the country. For years, patients who require such treatment have been referred to the neighboring country at a very high cost to both the country and families, as the process of ultimately access to care is often delayed, with majority of patients typically receiving care at an advanced stage of the disease and resulting with mortality of more than 50%. That's a lot of deaths. It was in this context that the government of Lesotho signed a memorandum of understanding with Apollo Hospitals in 2016 for provision of specialized health care services of cancer and other conditions which cannot be managed by our health facilities. Because control of non-communicable diseases is a major priority of the current coalition government in Lesotho. In June this year, we initiated an implementation of the agreement. The implementation saw the first batch of Basotho cancer and kidney patients sent to Apollo hospitals for care. I had the privilege of visiting our patients currently in Apollo hospitals in India on Tuesday this week. I was encouraged by the progress they have made, and I sincerely thank the hospital and its management for taking care of our people. Together with patients is a team of doctors and other healthcare professionals who have been trained in advanced management of kidney and cancer diseases to facilitate follow-up of patients post-discharge from Apollo hospitals. While we are battling against HIV and tuberculosis, we also want to work with Apollo in areas of kidney transplants and oncology, which are key priority areas for us. The government of Lesotho is committed to working towards bringing transformative change in the healthcare of our people. Building our health infrastructure with the latest technology is important, as many of our people live in remote villages that can only be accessed over steep slopes and rough terrain. The government has promoted public-private partnership initiatives to transform the operation of facilities, improve the quality of care they provide, and to build capacity in the public health system. In this context, we are open for partnership with those with the requisite capacity and expertise to improve our health services. As I conclude my remarks, Program Director, ladies and gentlemen, I want to point out that indeed India and Lesotho share a similar history. They have common ideals and aspirations as developing countries. The two countries have cooperated in many areas, including employment generation, agricultural development, education, tourism, and upgrading of infrastructure. Bilateral relations between Lesotho and India have been instrumental in ensuring that our partnership with Apollo Hospitals Group exists. We are looking forward to nurturing this relationship and taking our relations with India to even greater heights. With our cooperation with Apollo Hospitals Group, we are set to achieve the lofty goal in ensuring healthy lives and promoting the well-being of all at all ages by 2030, set by the international community. I thank you all for your attention. Kgotso Pula Nala, which means peace, reign, and prosperity. Thank you very much.
Thank you very much, sir, for the inspiring message. I now request Dr. Pratap.
First, we thank His Excellency, the Prime Minister of Lesotho, to be here and deliver the special address for us. We assure him whatever we have done before will continue but we'll do more together for the betterment of people and better health for the nation. Thank you, Your Excellency, for being with us today. I am thrilled to see Dr. Fines from Mass General Hospital. It reminds me back when I worked there 60 years ago, doing my cardiology fellowship. Today I was looking at him and imagining Ether Dome, their auditorium, and saying what all happened there is what Dr. Flans was talking about, saying, how can we improve and give people better knowledge for ultimate care for patients being a hospital and being a doctor. Thank you, Dr. Flans. It's wonderful. I have no special mention of our very important person, our AARP Chairman, Dr. Bharadwaj. Thank you. What you have said about the work done by all of that team, and today that you are happy that they have done excellent work is a great certificate to say we can do it. But I thank your wife more than that, because I think we need more people like them to study and understand how we can maintain ourselves and prevent ourselves from these dreadful problems. And please convey my very sincere thanks to her, and I hope many men and women will follow her advice. To the First Secretary Health, to you, Diana, I'm very happy that we have a long relationship with Uganda. We will continue to do better health relationship. To Dr. Abdullah and from MN, thank you. But I am sincerely thankful for the faculty who have come from US, from Europe, Australia, all of these, to participate and in this unique conference, when PTC OG and Apollo Hospitals brought this 2 days conference to educate ourselves. What can this do? How can we manage a killing problem? Previously, cancer was a death sentence. I think it was this hotel 5 years ago when we had an international oncology conference. I told them, please give me a recommendation. And the recommendation they did was, cancer is curable. And that's our logo. Cancer is curable. So and I think that for cancer is curable, we need to work hard. That especially the physicians and the government, to educate the people for prevention and early diagnosis. If early diagnosis is done, they could be normal. They could go back and live a normal life. We have known a number of people whom we could detect. For that, way back in 1974, long before Apollo, I started a program called the Health Check and call it Master Health Check. And today we have done over 20 million health checks and preparing ourselves, saying we should take this program worldwide so that we can educate people on the state of their health, and then to see how they can prevent themselves and get cured. Go to doctors early, go to hospitals early and get cured. So I think today, when we've introduced this proton, it was not an ordinary decision, because first at that time still there was great doubts 5 years ago, saying, can it do all? Can it make a significant impact? I'm happy in these 5 years, and they all said, today it is a tool which will make almost 100% promise of what it what its doctor does. That's what that machine is, and I am thankful for all the people who worked hard to bring this to the level to say, now today unofficially, Chairman AARP said, you can think that you have got permission to go ahead and treat patients. I am happy in your presence. He didn't openly say this, but he said he is very satisfied and we could start treatment of patients who have been waiting desperately for this. But I am reminded, today I must thank all of you. More than 500 of the specialists, oncologists, who have come from different parts of the country, different parts of the world, over 35, 40 countries. You all come here to see what can this do and how can we participate in managing oncology in our own specialities, in our own countries, and when we can use Apollo. I assure you, we are with you. We are with you in many ways to get connected through the IT and whatever, to see that the best can be done for the patient who walks into the hospital. That's what we live for. We live to fulfill the trust that people have placed in us. And I assure you that Apollo and the Proton Center will do this. But seeing all of you today, it reminds me way back. In 1983, when we opened the hospital, we also had the first gadget, the first CT scan in the country was brought by us. And the medical superintendent of Jaslok, Dr. Mehta, went on scolding me at least a dozen times. You are such a fool. For a hospital, you have already spent 25% of your budget on one machine. How do you think people are going to work this? How do you think they are going to treat with this machine? Now, 6 months later, he came and then said, Dr. Reddy, I have seen this for the last 2 hours. It's absolutely wonderful. I wish I have one at Jaslok, but I don't have the money today. I took him to my room, called Dr. Reinhardt in Siemens. I said, please give them a machine, they'll pay on installments. That was the second CT scan in the country, and today imagine what all we have. So I am proud that in the last 35 years, our anniversary took place about 2 weeks ago, we were reviewing how the healthcare has evolved in the last 35 years to be able to give practically everything that's happening anywhere in the world is being done, not just Apollo alone, good hospitals in the country. We have an outstanding liver specialist, Dr. Rela here. People from all over the world come to him, and the results are the same as the best centers anywhere in the world. This is what we are doing. It's not just Apollo. India is able to come to that level that more than 60 to 65% of our patients are able to get the world-class care at a moderate cost. Our costs in majority of things are less than 10%. I assure you, even in Proton, our costs are going to be very much lower than any place anywhere in the world. That is an assurance for the patients and for the doctors who would like to use this facility. But more importantly, I want to say a few words which you all know. 35 years ago, the problem for the country was to have such facilities to manage diseases of various patterns. Today we are doing everything. We are doing the transplant, heart transplant, liver transplant, pancreatic and the kidney transplant. We are treating every single disease possible. But then the health scenario has changed. According to World Economic Forum, the new disease called the NCD is going to kill 70% of the people at an younger age by 2030. And the cost is going to be $30 trillion for the country And for our country alone, it's going to be 4.8 trillion, which is going to be 50% of our GDP. Again, going to make a significant impact in improving the health of our people. So I think there is a great importance that people have realized that if you go to a doctor, you don't go for curing your illness. For you must go to a doctor first to find out the state of your health. And more often, they'll probably find early enough so that you can get back and smile and say, I am absolutely fine. So I think this is my advice, and I am very happy that the world is thinking in a similar way, and our Apollo will walk our mission statement on day one that will bring everything to our facilities.